What are the key elements of practicing informed consent? Imagine you're about to make a big decision about your health or a medical procedure. Would you want to know everything about it first? That's exactly what practicing informed consent is all about. It's a process that makes sure patients have all the facts before agreeing to any treatment. This is especially important in bioethics and societal challenges, where trust and transparency are key. The first element is the disclosure of information. Healthcare providers need to explain the diagnosis, what the treatment involves, and why it's recommended. They should use simple language, avoiding confusing medical terms, so you truly understand. It's also important they tell you about the benefits and the risks involved. For example, if a surgery has a small chance of infection or complications, you should know that upfront. They should also discuss alternatives, including doing nothing, so you can compare options. Next is comprehension. It's not enough to just hear the information, you need to understand it. Providers should check if you grasp what's being explained. They might ask you to repeat it back or answer questions to confirm understanding. This step makes sure you're making an informed choice, not just signing a form out of obligation. Voluntariness is another key element. Your decision must be free from pressure or coercion. No one should rush you or make you feel guilty for saying no. Your choice should come from your own values and beliefs, not from someone's manipulation. Decision-making capacity is also vital. You need to be able to understand the information, appreciate what it means for your life, reason about your options, and communicate your choice clearly. If you're unable to do this, a legally authorized person, like a guardian, can give consent on your behalf. Documentation is the next step. Usually, this involves signing a form that confirms you understand what was explained and agree to the treatment. It's a record that shows the process was followed properly and protects both you and the healthcare provider legally. Patients should also have the chance to ask questions. This dialogue helps clear up any doubts and builds trust. Providers should be patient and willing to answer honestly, making sure you feel comfortable with your decision. Finally, the process should be tailored to the situation. For simple procedures, less detail might be needed. But for complex or risky treatments, more thorough explanations and discussions are necessary. Practicing informed consent is about respecting your right to make decisions about your own body. It's a moral duty for healthcare providers to be honest, transparent, and supportive. When done properly, it builds trust, promotes fairness, and ensures that your choices reflected your personal values. Remember, informed consent isn't just a form to sign. It's an ongoing conversation that puts you in control of your health.